biological principles of orthodontic tooth movement and biomechanics. But first, my pet poodle. Very basic slide showing orthodontic tooth movement. It's a good starting point, however, and we'll build on it as we move forward. It's showing a force on the upper right, pushing a tooth from right to left. On the left side, there's compression adjacent to the root. On the right side, there's tension in the periodontal fibers. The pressure side recruits osteoclasts to resorb bone. On the tension side, osteoblasts are present, which form bone. Osteoclasts look like uneven scalloped cups or margins histologically. Something like this, the cupped area. And again, the resorption or pressure side of the root. Osteoblasts are present on the tension side, and bone is deposited in this area. First, an organic matrix called osteoid bone is laid down, and with some time, calcium salts are deposited. Bone calcifies. It's important to know for quiz and test questions that osteoid bone is more resistant to resorption. This shows up later when we talk about the most efficient type of orthodontic tooth movement. Is it constant? Is it intermittent? We'll get into that later. And the look of osteoblasts and the bone that is forming virtue of them. Bone forming again on the tension side. The first slide was rather simplistic because actually a tooth moves in a series of wiggles so that actually you can see both resorption and deposition on the same side of the root. The cartoon showed all deposition or all resorption. We can talk about changes with orthodontic tooth movement at the level of the tooth, bone, and the periodontal membrane. At the level of the tooth, the pulp causes some hyperemia. Slight forces cause hyperemia. That's shown quite often by thermal sensitivity. If you have excessive forces, that may cause pulp degeneration. Actually, in our informed consents, we talk about the possibility of a tooth going non-vital. Clinically, it's not a very significant problem. Usually in history, and that's why we always take a good history, there's some history of trauma that by chance shows up in the course of orthodontic treatment. So it's fortunately a rather rare event. Cementum can be resorbed with forces that are heavier than they should be. Cementoblasts can fill in these punched out or resorbed areas. In the dentin, you can have the same thing. Dentin can be damaged, causing root resorption. Root resorption is rather common. We don't like it to happen, but it happens, and whoever figures out how to prevent root resorption will win the gold medal of orthodontics. Now, clinically, it really isn't a problem. The analogy I use is that you have a tree root that's 17 feet in the ground, and now it's 16.25 feet in the ground. It really doesn't make any real difference. You can have very severe root resorption where maybe half of the root is resorb, but again, rather rare event. In the enamel, the main changes are decalcification, which can be significant. This patient had braces, and we took the braces off because the hygiene wasn't under control. Now, I would never put braces on somebody who presented with this. If somebody presented with this, I'd give oral hygiene instruction. Actually, my protocol is to give the instruction, take photographs of it, have them come back in a month or so, assess the progress or no progress, and if it doesn't improve, I simply won't do braces. However, sometimes you've committed to it. The hygiene is adequate, the patient is in treatment, and maybe there's some life event, something where the patient, the child, is having a hard time at home and changes their hygiene routine, and it deteriorates, leading to this. The other simplistic part of the first slide was that there was a point force shown on the upper right, and the tooth was moving in a linear fashion, that is upright. Actually, if you have a point force, the tooth will rotate at a center of rotation. In this course, in this lecture, the center of rotation and center of mass terms are used rather interchangeably, but basically it's a point about a third up from the apex of the root. So you have a point force, the tooth is rotating, and you have the greatest rotation, or rather the greatest resorption at the palatal crest. Resorption gradually reduces down to the center of rotation, and then it builds back up again. The periodontal membrane, source of proliferating cellular elements. Immature fibroblasts probably differentiate into osteoblasts, osteoclasts, and the lower bullet is showing what the previous slide did, that you have most compression of the periodontal membrane at the crest, alveolar crest. It decreases to center of rotation and then increases again. The optimum forces are slightly above capillary pressure, that being 20 to 26 grams per square centimeter. Now, I've never asked or seen a test question asking you to cite 20 to 26 grams per square centimeter, but the point is there is an optimum pressure. Actually, it's easier to visualize, easier to describe, that if you compress the periodontal membrane about a third on the pressure side, that's ideal. There's an increase in cell production and blood supply. Osteoclastic activity is stimulated in lamina dura on the pressure side. You have optimum osteoblastic activity on the opposite tension side, and the tooth moves favorably. If you have excessive pressure, the periodontal membrane is crushed on the pressure side. There's necrosis present. On the stretch side, you have torn periodontal ligament fibers, hemorrhage, and there's no tooth movement until necrotic tissues are removed. We have what's called undermining resorption, that being bone, recall, is elastic, so this optimum pressure isn't seen adjacent to the root in compression. It's further away from that, inside the bone or interior part of the bone, and a cavity forms from this resorption, and the tooth in movement eventually jumps into this cavity. But then it's a slow process and starts over again. The point is, we don't want excessive pressure. Biomechanics. There's optimum forces for tooth movement, 50 to 200 grams. Going back to your Physics 101 class, mechanics are the effective forces on body. We talk about centers of mass, which are free bodies in space. Center of resistance refer to restrained bodies, be it teeth within jaws or icebergs. In physical terms, a tooth is a body with a center of mass. The center of resistance of an iceberg is located below the surface of the water, and the center of resistance is located on the root. Again, this point